chairman of today's occasion, our esteemed president, distinguished ladies and gentlemen. It's my pleasure on behalf of the Association of Hospital and Administrative Pharmacists of Nigeria to present to you, addressing the challenges of institutional business, a repositioned drug revolving fund scheme as a panacea. It's taken by me, Pharmacist ELECHI, National Chairman. What's our outline? We'll look at some definitions. We'll look at the diagrammatic representation of the DRF scheme, the purpose of the DRF, the challenges of the DRF scheme as presently operated, the consequences of a dysfunctional DRF scheme, proposed solutions to address the challenges, key features of the bill, benefits of the law if enacted, major highlights of the bill. We'll conclude, and then we'll look at what's next. Let me emphasize here that is our only two way of seeing how we can support the industry, because we are concerned about what is happening in the public health sector. We all appreciate the fact that the public health sector, the business we do, which is supposed to be driven by the DRF scheme, has been, the DRF as it is has been bastardized, mutilated, pillaged, and as such, we are very much concerned as practitioners. And so, we decided to think outside the box, and that gave rise to what we have here today. So what is a drug revolving fund? We say it is a system whereby revenue generated from sale of drugs to patients is used to purchase new drugs and ensure availability, effective and efficient system. That is to say, you put money, you bring money, call it seed money, procure seed stock, and use the seed stock to treat your patients, and you generate revenue. And when you generate revenue, you plow it back into the system. That is the long and short of the entire grammar there. What are health commodities? We say they include medicines and consumables. And of course, we know what consumables are. This is a diagrammatic representation of the DRF. You have an initial fund to give rise to a seed stock with a markup, gives rise to stock in facilities, and of course the patient receives the commodities through user fee, and then fund is generated, and then the money is plowed back. But if you look at that arrow going up there, you will see that this process, this cycle is truncated. It is truncated because the money, which is your capital, goes into a whole lot of things in the hospital. Electricity bill, accreditation exercise, tours and travels by the CEOs and other principal officers of the institution, routine maintenance, public relations activities, and so on and so forth. At the end of the day, you have a situation where the fund is decapitalized, resulting into huge debt to the pharma industry. What is the purpose of a DRF? The purpose of a DRF is simply to ensure the availability and sustainability of quality healthcare products, ensure accessibility and affordability of health commodities, reduce the burden of stockouts, support healthcare for the indigent and the vulnerable, curtail dependence on external funding. That is to say, you will not require budgetary provision to be able to procure drugs, and then enhance the attainment of universal coverage. These are the purpose of the DRF. Challenges of the DRF as presently operated. These are the challenges. Poor management of the scheme. The advantages of the DRF as conceptualized has not been manifest because of the following factors. Poor management of the scheme. In most cases, you have a lot of executive interference, money is removed from the DRF and so on and so forth. Lumping of the proceeds of the fund into one general account in violations of the provisions of the extant circular, or the policy document, as it were, because the policy document may declare that the DRF should be maintained as a distinct account. But in most places, it does not apply. Even when they want to apply the Treasury Single Account Circular, they apply it in breach of the provisions of the circular, which says that you should have a distinct account for the DRF. Of course, misapplication stroke misappropriation of the fund, like I earlier highlighted, executive interference, non-existent regulatory regime manifested in the absence of sanctions for non-adherence to lay down rule, procedure, and rules. And that is what has given rise to what we are discussing today. What are the consequences of this dysfunctional system? This results in the decapitalization of the funds, like I earlier highlighted, accumulation of debt to pharmaceutical suppliers, resulting in loss of value of the funds when paid due to inflation. Let me emphasize here that in very many cases, the CEOs are usually a bit reluctant in paying suppliers. Money is generated. It's not that the money is not generated. It is generated, but it's used to do a whole lot of other things. I recall a situation where a particular company was owed for about 3 years. Of course, when you get that money would have lost value. That money cannot buy you the same quantity of products you supply to that institution. And one CEO in the eastern part of the country told a rep, why don't you tell your management to write off this debt? And I begin to wonder, that CEO, does he appreciate how money was sourced to run the business, whether it was borrowed fund or not? Of course, the consequence is also refusal of the suppliers to sustain the supply of medicines, resulting in high prevalence of out-of-stock syndrome, and of course the ensuing negative image of our practice and our hospitals as mere consulting clinics. So, what are the proposed solutions to these challenges that we have identified? And so, as an association, we relied on the provisions of the National Drug Policy, 3rd edition, 2021, in Article 6, which provides for appropriate legislation to strengthen the DRF. And so, we developed a bill for an act of parliament to drive the operations of a DRF. It was our conviction that the DRF needs to be moved from the realm of just being a policy of government to an act of parliament. That way, if people know that they are likely to face some sanctions if they violate the provisions of the law, it will deter them from doing certain things. Because over time, we have come to the realization that when people violate policies of government, the worst they get is an administrative query, an administrative action. And in most cases in the Federal Ministry of Health, because of the spirit of esprit de corps, the people at the helm of affairs are usually reluctant to sanction their colleagues. So this bill will have christened essential medicines, health commodities provision, management and utilization in public health institutions in Nigeria. This bill is pending before the National Assembly. And I'm delighted to report that it has gone through the first reading in the Federal House of Representatives. What are the key features of the bill? Key features of the bill include creation of a separate account for the DRF, domiciled in a transit sweeping account with a financial institution. Appointment of a financial institution as fund manager. What we are trying to do here is to divest the CEOs of these public health institutions of powers of control over that fund, because that is the bane of the DRF as being operated. And then the bill also seeks to provide sanctions for errant officers of the scheme and for non-adherence to the provisions of the Act. Additionally, let me also inform us that we have also created a role for the ministry, Federal Ministry of Health, over the scheme. Okay, thank you, ma'am. These are the benefits as that can be outlined. Importantly, let me state here that it will engender of the operation of a scheme that guarantees prompt payment of suppliers, and it will return the pharma industry on the path of continuous growth and profitability. It will ensure we have a win-win situation for everybody, and it will yield adequate returns on investment to stakeholders. These are the major highlights of the bill as a special intervention fund. The scheme will be operated based on business principles. These are the composition of the members of the committee of the management committee of the bill, of the fund. The functions of the fund manager is well spelled out. He is responsible for the overall management of the fund, shall undertake prompt payment of suppliers of the scheme as provided in this act, shall ensure that the fund of the scheme is not utilized for any other purpose, save as provided in this act, shall ensure that not more than 70% of the monthly operating surplus of the scheme is remitted into the IGR account of the public institution. That is after the account reconciliation must have been done, and the suppliers must have been paid. Whatever is left as surplus not more than 70% is remitted into account. The other 30% is retained as a stabilization fund to drive the operation of the business. But we appreciate the fact that most institutions owe suppliers a lot. So that 30% can be plowed back in paying for old debts. Scope of application, it applies to all federal health institutions, all the public health owned by the federal government. Of course, I've talked about the position of the DRF, of the ministry on the scheme. These are management of funds. What will happen to the fund? How the fund will be managed. Let me just highlight the very important ones. All payments shall be taken. Under no circumstance whatsoever shall the fund be used to finance other public health institutions' expenditure, unless as provided in this act. And then we've talked about this. And then we are also saying here that it shall be an offense to violate any of the provisions of this section. These are other parts of the act. There shall be no mobilization fee. But however, full payment for the supplies shall be settled promptly and diligently within 60 days of completion of supplies. These are the issues. And then there are offenses and penalties. What constitutes offenses and penalties? Undue delay in giving approvals for payment of supplies in excess of 15 working days. We realize the fact that some CEOs, when you have submitted your application for payment, they sit on it for eternity. God knows how long. Some people even sit on it for 1 year. They don't approve. And so we have made that, taking that into consideration. Undue delay in payment of suppliers or contractors in excess of 3 months. When you owe a supplier who has supplied you and completed the entire due process, and you owe him for more than 3 months, it becomes an offense, and you know you're liable. So you'll be complied to doing the proper thing. And then these are some other minor offenses that we also talked about. Conclusion. Arising from the foregoing discourse, we can draw firm conclusions as a re-engineered DRF becomes a veritable opportunity for pharmacists and other stakeholders in the pharma industry to grow their business to greater heights. A repositioned DRF scheme offers the industry an opportunity for continuous growth and profitability. The healthcare delivery capacity and capabilities of our public institutions are enhanced. There is guarantee of drugs and health commodities availability, including service, as wastages and abuse will be reduced. The enhanced regulation and oversight by the ministry on the operations of the scheme improves health outcomes. Of course, contravention of the provisions of that are backed by enforceable penalties and sanctions that would engender vigilance and compliance. The position of the scheme will encourage investment as investors will be assured of their ROI. Our medical facilities are better equipped to deliver services on this core mandate. What next? We need to secure the buy-in and support of key stakeholders in the pharma industry, notably the CEOs Forum, PMG, Nairo Pharm, AHAPN, FEMPIA, IPMIN, to the actualization of this laudable initiative. And of course, we need to mobilize resources for advocacy. And then we need to deploy lobby as a strategy. And then continuously lobby at the National Assembly and other relevant departments of government to see to the fruition of this. With this, if pursued and actualized, I am certain and confident that we would have been able to survive the shocks and then tame the tides as it affects the public institution business in the country. Thank you, and may God bless you.